like far away from me.
It's such a, every time I visit, I'm like, damn, this is an amazing city.
It sure is.
It is, yeah. I mean, many complicated histories, but yes, it's like definitely has something for everyone.
Nice.
I think it's,
Okay.
It's really big.
It's very, yeah.
Because I never want to like go into New York and be like, yes, I would love to live here, or LA or something.
Right.
I feel like Chicago's in the same vein as that.
It's much more approachable.
Yeah. So I looked into residencies here actually when I was applying.
I know, everybody was like, where is she? I was like, I know I saw Ginny. You were taking pictures in our thing.
Interesting.
And I didn't really care for the program at all. And that was the only program I had in Chicago. I was like, well, okay, I guess that's not
And that answered that question, yeah. Well, I'm glad you went with like what is better. That's definitely. Someone had said that like you'll know, like when you go through these things you'll know, and I was like that's not helpful, but it was actually so helpful.
The thing is, though, I imagine now you're not. I imagine you were involved in applications during COVID, right, with interviews.
No, I just I was the match right before.
I just meant like, were you involved in interviewing or being involved with interviews during
interviews,
video?
yes.
I just feel like it's not the same.
No, 100% no.
They are
You
great.
can kind of fake it for an hour. But you
So
can
Michael
fake it for-
Kors has very
And it was
comfortable.
reflected. Like I feel like
Heels.
applicants said this feels like not as helpful. As
There are only certain heels I can wear, so Michael Kors is one of them.
I 100% agree. It's very different.
And it's
And it's like so many things. Like sometimes it's apparent. And sometimes like just how someone like moves and carries their body and talks to you. Like it's like it tells a big story.
We'll go ahead and get started. So hello and welcome. If you were here yesterday, welcome back. And if you're joining us today for the first time, welcome to day 2 of the 12th annual Family Medicine Midwest Conference. My name is Andy and I'm a medical student at the University of Illinois College of Medicine on the Peoria campus. I'm also the student member of the Family Medicine Midwest Board of Directors. And I'm also a Naperville native. Welcome. Sadly, my term on the board ends in December, as does the term of our resident physician board member. I'm asking you now to think about if you would like to take my place on the FMM Board of Directors for the calendar year of 2024. Information and the application are already up on the FMM website board page under the About Us tab, and also on the resources section of the conference app. I'll also be here all weekend, so please feel free to ask me any questions about this leadership role. The deadline to apply to this will be on December 1st. Students play a key role in planning each Family Medicine Midwest Conference and serving as ambassadors in promoting this conference and assisting in every aspect of the event here on site. One of those outstanding students is here on stage with me to introduce our student plenary presentation. Hirak, take it away.
Hi everyone, my name's Hirak. I am a third-year medical student currently doing rotations in Chicago. This year I had the pleasure of serving on the conference planning committee to develop the theme of this year's plenary sessions and organizing the conference as well. We hope that each plenary will inspire the audience and the entire conference will provide knowledge, perspective, connections, and most of all that everyone has a fun time. Today we continue the journey with our conference theme, Family Reunion, Uniting the Past, Present, and Future of Family Medicine. As you probably know, we are the future of family medicine. So this presentation is all about your future and the future of compassionate, comprehensive, and patient-centered care. Family medicine has made a conscious effort to remove barriers to access of health and obstacles in pursuing medical careers. Here at Family Medicine Midwest, we strive to make diversity and inclusion a part of everything we do. It's my honor to introduce our student plenary session for today. Our session is called Family Medicine, Oh, the Places You Will Go, and features a panel of residents and early career physicians who all have unique journeys and stories to share with you today. Our moderator is also the co-chair of this year's conference planning committee. Dr. Safiya McNeese-Ruffin is Associate Program Director at SIU Alton Family Medicine Residency Program and the Director of Obstetrics and Women's Health. She was the closing speaker at the Family Medicine Midwest 2022 conference, and we are thrilled to have her in such a leading role for this year. She will help welcome our panel and lead this session. Dr. McNeese, I will hand the floor over to you.
Thank you so much, Hirak. All right, so we're going to get this session started. Greetings and welcome for this talk and this exciting panel we have. Having the honor to serve on the FMM committee, we were very adamant that we gear a conversation to students in particular. As we celebrate the diverse experiences of family medicine, our panelists are ultimately here for you and are eager to cover inquiries that you may have so that all of your questions can be answered. After our session, please feel free, please be thinking about questions that you have now so that our panelists can offer you some expert advice. So I just want to introduce you very quickly to our panelists because I want to get underway. We have Alexis Acernese. She's a chief resident physician and a PGY3 at Rush Copley Family Medicine Residency program in Aurora. We have, yes, claps. We have Adjoa Kusi-Appiah. She is a second-year resident at the University of Minnesota North Memorial Family Medicine Residency Program in Minneapolis, Minnesota. We have Christine Knight, a family physician at PrimeCare West Town Health Center, Chicago, Illinois. And we have Metias. He is core faculty at SIU School of Medicine, Family Medicine Residency in Alton, Illinois. I'm going to give a little bit of a chance for them to talk a little more about their experiences. But first, I think we're just going to start with the question of why family medicine? Why did you choose? And I think I'll start with Adjoa.
Thank you. Thanks for letting me be here today, y'all. Like she said, I'm Adjoa Kusi-Appiah. I'm a second-year resident at University of Minnesota North Memorial. When I think about why family medicine, that's such a loaded question because I think about my purpose in medicine, which is really centered on promoting equitable health in the Black community. And that stems from my experiences when I was very young. So I'm from Detroit, Michigan. Went to Michigan State for undergrad, went to Michigan State for medical school as well, so go green, go white all the time. And I spent some time in Detroit proper and then also grew up in the suburbs. So I saw very early that there was a stark difference in these two places, though they were 15 miles or so apart, but they were so different in so many ways. I didn't understand why. But I also took note of how the different individuals lived their lives and how they were able to or not able to stay healthy. What were the barriers to that? Where they lived, where they worked, where they played, right? Their social determinants of health. And I saw that, took note of that very early, and I continued to think about that throughout my career of learning and being in college. And I said, okay, well, this is a problem, so we got to fix it. How are we going to do that? And I thought about medicine being a way to attack those different barriers. And specifically family medicine, so primary care, the doctor that you see all the time, the one that you say hi to, and this is what's going on in my life, but also this is happening in my body, and I trust this person, and a person that really can understand not only the individual, but also the community and what's going on. So that's why family medicine, that's why I'm happy to be here, that's why I'm happy to serve as a family medicine doctor. This is what keeps me happy.
Thank you so much. Thank you. Very powerful, Adjoa. Mena.
Okay. Hi, everybody. As Dr. McNeese mentioned, my name is Mena Metias. I'm one of the core faculty with the Southern Illinois University Alton program. I am originally from Winnipeg, Manitoba, Canada. I went to medical school in St. George's University in Grenada in the Caribbean. I did my residency training in, I actually did my clinical experience in Toledo, Ohio. This was my first time actually living in America, and I was like, the Midwest is really not so bad, so I'm going to focus mainly on applying there for residency. I was fortunate to get residency in Indiana University School of Medicine in Indianapolis. I was very lucky. I love the program I worked in, and now I live in St. Louis, Missouri, and work in Alton, Illinois. They kind of right across the Mississippi River from each other. I've been in with the residency program since it started 3 years ago. I came into it right after graduating. So I went from brand new third year, an old jaded third year resident to a brand new faculty who is terrified and being an advisor to first year interns while I was a resident like 15 days ago. But yeah, I think what got me into family medicine in general, I think being in Canada, I'm originally from Egypt, from the Middle East, and going through all these different stages in my life, I had a lot of experience with, I had physician parents, and I was able to see how they were able to acclimate in different locations as we escalated. And I'm kind of ADHD, but I'm also a bit of a perfectionist and really wanted to be good at every position I'm placed at. And I think, so I stayed open-minded throughout all of my rotations. But really with family medicine, it kind of put me in the position of wherever I'm at, I'm not the off-service resident. I am a pediatrics resident on pediatrics, I'm an OB resident on OB, I'm an ER resident in ER, and I held that as a standard for myself. And I'm very fortunate to say that family medicine has definitely given me that opportunity in order to wear the many hats while also having that human component of being a physician for people. And I think it was, as someone who's coming into the role of being an attending more and more as every year, you're learning to swap that vignette of 75-year-old male with past medical history of coronary artery disease to Mr. So-and-so with heart disease who's here to see you. And it's a really fascinating shift, and I think family medicine is one of those very few positions where you can do that, talk about their child or their grandchild, and also see their grandchild, and it's just an incredible experience. And I think that's really why I chose family medicine and why I'm very, very happy to be in family medicine and representing it.
Thank you, Mena. Absolutely. Let's go to Christine.
Yes, I am very grateful to be here. My name is Christine. So I work for an FQHC in Chicago called PrimeCare Health. It is also where I trained through Ascension, St. Mary's Chicago. That was our continuity clinic. And so I don't know if I'm alone, but I was kind of the person that was always like, why not family medicine? Because to me, it felt, one, I love it, but two, I think it felt like a really natural extension of community organizing work, and it felt like such a natural tool set for us to be adaptable and to really see the communities that we work with and get the tools to respond to how our communities are adapting. Because as was so beautifully pointed out, sadly, most of our patients and even our own friends and family and community can't control many of the things that are going to happen to them and what life brings them, but we are fortunate enough to kind of see these shifts and see people through their lifetimes and see their families and see where they're living and where they're growing, and then have the resources and say, oh, I see this trend happening, I see this thing happening, and have both the knowledge and the skills to offer some support in that kind of transition. And in that, I think instead of kind of being this really methodical, I am treating the pathology of COPD, we kind of then transition to saying oh, I am working with this person who is experiencing this thing biologically and psychologically and socially that is affecting them in this way. And I think that feels like something that I can do for, many years to come. So I'm grateful for family.
Thank you so much. And Miss Alexis.
Hi guys, my name is Alexis Acernese. I am a third year at Rush Copley. I am actually originally from Florida. I did my medical school at St. Matthew's in Grand Cayman. Did my medical rotations through New York and through Orlando, Florida, and the match brought me to Illinois. I chose family medicine because I loved everything. I went through medical school and I loved every rotation. I loved OB, I loved being hands-on in surgery. I just couldn't make up my mind, and I think a lot of people go through that when they go through the whole medical school rotations. Very confused and things like that. Family medicine was my last rotation that I went through, and I am a people person. I'm a very extroverted person, if anybody knows me. And going through that rotation, you could really appreciate how the mentor that I had developed his relationship with his patients. I think everybody here really put it beautifully that it is something more than just treating a disease. If you can establish a relationship with your patient, you really can do a better job as a physician. And I saw that very adequately and very eloquently when I was rotating with him. So that got me into family medicine. One of the things that I noticed too is family medicine really opens the door to all of the other specialties, and you kind of are the navigator to have your patient go to whichever specialist that you deem appropriate. And I think that's something so special. Seeing someone from newborn and treating their whole family is something no other specialty really can have. So that's something I always felt really passionate about. And when you see patients on your clinic schedule and you know them, it is such a great feeling because they kind of said it yesterday in our opening speaker. You develop a relationship with them and you know the little things about their lives. Oh, they just went on this trip, and oh, how is your grandson doing, and XYZ. It's just something that is a little bit more than just doing a job. It's really being a person and being a friend to a lot of your patients. So I love family medicine. I'm proud to be a family medicine resident, and I'm happy to be here today to answer all questions for you guys.
Alexis, thank you so much. One more general question I want to go to, and hopefully you all can answer this. What has been the biggest hurdle or obstacle or something surprising about your career so far? And I think I'm going to start with Alexis.
I can answer this. Going through my 3 years, the hardest part is the challenges you get to in regards to things out of your control. A lot of it is the prior auth. You want to treat your patient with a certain medication that you know they would do well on, and you have to go through all of the hoops of doing XYZ beforehand. All of the paperwork, all of those things, it kind of puts a downturn on medicine because you want to do the best for your patients, and it just makes it a little bit more challenging. The peer-to-peers that you have to sit and do for 30 minutes and explain why this patient should have this test done and not the other test from someone that sits in a room and is telling you that your patient shouldn't have this, but they don't know your patient. That's probably one of the hardest challenges to try to get through and try to kind of compartmentalize. I'm doing this because it's just the way it is, but I have to do it for my patient because that's what they need. So I would say that's the hardest thing that I've had to do so far. So I guess it's not that bad for some people, but I think it's very tedious.
Absolutely. Thank you, Alexis.
Yeah.
I'm going to come back down to the end. Mena.
Sure. So I think one of the biggest hurdles or challenges that I've faced, definitely to echo what Alexis mentioned, the silliness of, you have to learn that this new fancy medicine works wonderfully for this condition, but like 90% of insurances won't cover it, so it's kind of useless in your setting, especially in our settings as an FQHC. That's not something that we can manage. I think a specific hurdle that in my position as a faculty role I've faced and I've come to realize is much harder than you think is you have to wear all of that stuff as a family doctor, but also academic medicine comes with its own challenges. And in general, I don't know about if you guys have had much experiences with the locations you've rotated in, but it seems like a pretty common thing for family medicine attendings or just residency programs in general to be spread real thin. We're hurting for more faculty, and so the faculty that is there are taking on a ton of hats, and they're doing all that while making sure that we are producing residents that are going to be functional, really strong doctors. So in general, I think I don't know if it's a family medicine specific thing, but it's definitely an academic medicine thing. It's not as well incentivized, and obviously people are so excited to leave residency that they're like, why on earth would I ever come back to it? But it's needed, and you are definitely building the future of doctors. So if you want to have an active role in it, please consider it as part of your career because it's needed for sure.
Thank you, Mena. Yes, definitely what I hear is a plug for more faculty and also appreciation of your faculty, because they are spread pretty thin. Christine.
Yeah, so I think there's a theme, and I also reflect what has been said, especially with the process of practicing, as the humans that we are and wanting to offer care and health and not just health care. And so that constant juxtaposition with our healthcare system, to me, feels like one of the biggest challenges. I'm a very new physician. I just graduated from residency, but again, I did work with the same FQHC through those years, and it is hard. Like, it's hard to have to go through these prior auths, and it's hard to be like, I'm going to be the best evidence-based doctor out there and read everything there is, and then you get there and they're like, no, you're not. And so it's hard to explain that to patients, and it's hard to sit with that grief. It's hard to hold space for stories of people. Sometimes I tell my patients, I'm like, just dish your healthcare trauma and then let's build something different, because I think that you probably all have seen that that is a huge part of and a big barrier to offering both care and offering health. So, but I still think we can do it.
Thank you, Christine. Yeah, that can be, the emotional aspect and the trauma of our patients. It can be hard to deal with. Adjoa.
The biggest surprise / obstacle that I've encountered is, okay, we know residency is hard, John. We know this. And I think a lot of times, okay, first year is super hard because you're no longer a student, and now you're a resident, now you're a doctor, now you're seeing all these people. And that's a steep learning curve. We always talk about that. And then you kind of get in your groove, you're like, all right, I got this. And then second year comes, and I'm second year now. And then you forget that you're the steep learning curve restarts again with more responsibility and more autonomy and more this, more that, while you're dealing with the things that they've all described. That cognitive dissonance that we have with the healthcare system and wanting to be a great doctor for our patient and a person that they can trust and do the best things, but you're still learning and your brain's still going and you're doing all the things, and sometimes it can just feel like you're staying afloat, you're kind of like a cogwheel, you're just going, and then taking that minute to step back and be like, all right, am I having fun? The fun that I want to have throughout this process? Am I doing the things that makes me happy? Am I present enough for my patients, but also for myself? So that's something that I've continued to work on this year, and it's just been difficult. We talk about the many layers of this journey, but we don't give ourselves the time sometimes to step back and really digest them and call them out. So doing a little CBT on myself and being like, hey, what am I feeling right now? What's the feeling? Let me pick one. Because I'm feeling a lot, and my brain's saying a lot. But what am I feeling? I don't know. Let me sit back and figure that out.
Absolutely. I hear that imposter syndrome that we all feel all the time, and then just taking care of yourself. So, absolutely. Well, we're going to switch gears just a little bit. We have such a diverse panel, and as a committee, we handpicked our panelists because they are bosses in their own right, and even as young physicians and residents, they are leaders also in this struggle. And so I just want to kind of highlight a little bit about each of them and have them answer a question in their lane of interest. So I'm going to switch, since I said they're bosses, I'm going to switch to their doctor title. Dr. Metias, let me ask you a question. So our international medical graduates have become a huge part of our physician demographic. Can you share differences or unique nuances of the IMG experience that our students should be cognizant of?
Of course. I feel very strongly about this question. So as I mentioned, I am a Canadian Caribbean grad, so I'm a quote-unquote foreign IMG, or a non-resident alien per my visa status. So yes, there is definitely a lot of hurdles that IMGs in general have to face, whether you are an American born or not. I'll be frank, we probably have a little bit higher of a hurdle to face compared to someone who graduated from an American school in the location and is applying internally. You have programs that will automatically filter out any person who needs a visa or is from an international school, and so automatically, however much you paid to send that application for on ERAS is automatically thrown down the garbage. Let alone you have to. I feel like we have to work a little bit harder to get our foot in the door, and so. I don't know about you all or anybody who is an IMG in this room, but I definitely walked in with a bit of a chip on my shoulder of like, I need to prove that I'm just as good to be in this table as everybody else who graduated from the school. And so, I don't know, you kind of walk in with a little bit of a vendetta of something to prove. The good news is, I think family medicine as a career is probably, I don't know if, it's probably the most, or probably one of the most accommodating to international, both visa requiring and American graduates. I know for our program for sure, we definitely don't discriminate based on that. I know a lot of family medicine residencies definitely do not. And it's not I guess you'll go to like the lower tier residencies just because you're an IMG. You will go into, I have Canadian friends in Big Ten schools, in Ivy League schools, anywhere you want to go, you have an opportunity to be present, because I know that family medicine, I think, has been very open about looking past that. Most programs are usually pretty open with providing you with visas and hiring you based on that. So I think we are, my advice, if it's asked, really go into it knowing that you do have something to prove, basically, that you don't have the name of whatever school that you are applying for, but you have to show that you may not know where my school is, or you may not know much about the residents the quality, quote unquote, of residents that coming out of my school, but I have this and this and this qualities that will show you that I will become a strong doctor. And I'm happy to share that that is definitely something in family medicine that everywhere you go, you'll see that there are people from all over the globe practicing as fully licensed family medicine doctors. So it should not be something that will stop you in the long run.
Absolutely, Dr. Metias, thank you. I think I heard, know your worth and share your worth.
Absolutely.
Show them who you are. Got you. All right, Dr. Knight. So equitable and culturally competent care is necessary and a hot topic in caring for the patient population. How were you able to incorporate your personal interest in gender-affirming care into your residency education and now your practice as a family physician?
So I think, for me, it's gender-affirming care, but for you, it's, who knows what, and I'm grateful you have your passion, because, I think those can be really revitalizing things to have, especially in residency. But first and foremost, I want to say, this is not something that, first year I was out there and doing this, and first year I was just trying to get through first year, and I was trying to be a doctor, and I was just trying to take care of myself. So please, have patience and grace for yourself. Your passions will always be your passions, and the time will come. But that being said, I think a lot of what I wanted to do was kind of use the infrastructure of residency to help me kind of promote my own interests, which was gender-affirming care in one particular way. And so I think early on, I'm super grateful for my faculty at my program, because they were super supportive of me, and I had one attending in particular who I identified, and she was like, yes, we're gonna do this. And so I think seeking your advocates is really important, and it might not be an attending in your program, it might be attending in your city, it might be attending in another program, or it might just be a co-resident, but someone may have, if not an interest in your sort of special thing, they might at least be willing to support you in it. And then once I kind of identified that, this person helped me understand, like, there was a gap in that in my program at the time that I was there. And so she helped me build it through the framework of like AAFP's core educational like guidelines that say, you know, in residency education, if you're going to build curriculum, you have to address attitudes, knowledge, skills, and behavior. And so I started by using my required research program to do work around like understanding the residents' attitudes towards gender-affirming care. And that really helped essentially build an assessment of like, what are we missing and what do people want to see? And then I took that, and that helped me then kind of build more of a curriculum around it. And I don't know if you realize, faculty is stretched very thin, and if you're willing to do the work, most faculty are very excited for you to do that work. So it's like, so I worked with faculty, and we're lucky enough to have a faculty development tract. And so I took my work in that and got to build a curriculum. So we used like workshop time that we have once a year and did 3-hour workshops for residents around like knowledge and skills of gender-affirming care and providing it. And then again, look for your resources in your continuity clinic. So like my continuity clinic was PrimeCare, and PrimeCare at the time did not have providers providing gender-affirming care, and so they were like, yes, like let's do this. Like again, if you're willing to kind of put in that work, we're willing to build it into our infrastructure. And so they ended up opening a medical director position for it, and like now that I'm working for the clinic, they're letting me build templates for our EMR. They're letting us put in like letters and order sets, and now training for all, you know, physicians and providers so that they then can make the choice if that's something that they want to do. So it's like, I think residency is like a playground. You know, like we get through these first bits, and then there is space, you know, near the end of it where you get to really take those special passions. And I think in family medicine, there are so many people that are so excited about so many things. So it's like, if you don't know where to start, just like ask the person to your right and then your left, and then like eventually they'll be like, oh, I actually know someone over there and there, and like someone will have resources. And so, yeah, just let that revitalize you and let that become something that keeps you moving forward. But know that there's definitely ways to do it. Yeah.
Thank you, Dr. Knight, for sharing pathways to your passion. And I think I hear, and what I like to think, your passion or your gift will make room for you. And so the message to the audience is that there is room for your passions. But thank you. Dr. Kusi-Appiah, from personal experience and by word of mouth from learners today, learning how to get involved in avenues and advocacy are lacking in the medical school and residency curriculum. Can you share how you were able to get involved and advise future residents on how and appropriate times to become ambassadors for family medicine?
That's a great question. How my journey started way back when. So I kind of told y'all more about my passions and why I'm in medicine, and then how that translated to family medicine. And I was able to seek out opportunities pretty early for health equity related positions and leadership. So I worked at the Flint Center for Health Equity Solutions back in undergrad, did some research there, and then throughout my time in medical school, I just plugged in with the AAFP. That was my biggest thing. I looked for people who were doing things that I wanted to do, and I looked at their resume, I looked at what they did, and I was like, I want to do that, and I want to do that, and I want to do that. And I went and I looked at those websites and see what it meant to apply for those things, what they required of you, or what kind of, what I could get out of those things, and if that'd be helpful or on the same path as my purpose and my mission. So I would say that seeking opportunities and not being afraid to apply, I think that was the biggest thing. We have this like imposter syndrome, or feeling like, I don't have experience doing that, or I can't do that, or that'd be cool, but I don't know if that's for me. It's just putting yourself out there and trying. Not only does that give you space to develop new skills, but then you also meet new people. And then they can plug you with other things, and they can help guide your pathway into your passion and your mission. One of my most rewarding opportunities was being an AFP emerging leader. I did that my 3rd year of medical school. And it was virtual because COVID was just like kind of in the middle at that point. And it was an opportunity for you to create a project, community-based project, on an idea that was important to you. And you got this mentor through the program, and they helped you facilitate that project. And you could share that at the conference the next year. So my focus was on adolescent care and specifically sexual health, reproductive health education from an adolescent standpoint. And understanding what they knew, what they didn't know, how they felt like they were being taught, and if this could be improved. And that actually got translated to a resolution at the Michigan Academy of Family Physicians, and then was presented at the conference the next year. So these opportunities, they seem huge, they might seem out of reach, but putting yourself out there, so seeking, applying, connecting, and just seeing what comes of it, I think will put you in a space to do more things like that.
Thank you so much, Dr. Kusi-Appiah. Thank you for putting yourself out there and being an emerging leader. Dr. Acernese, as you are currently a chief resident, I imagine that you have navigated residency effectively and efficiently. Can you give other avenues, examples of leadership roles during residency and what you have learned from those experiences?
Yes. So I love this overall topic of the places you go, because now looking into my 3rd year, I sit here and reflect back on my 1st year and all of the things that I wanted to do. It was always, I tell my other residents, it was always my goal to be a chief resident. I always want to see the program, be the best it can be. But I also wanted to do things in other areas. So I'm from Florida. I didn't know much about Illinois at all. The match brought me here, like I said before. So I wanted to see what I could do in the community. So Rush Copley is part of King County. So they had a medical society. And it was something that I was interested in because, like you said very nicely, the relationships that you make in residency will go further beyond anything else. The people in family medicine in particular have connections everywhere. And I think it's really important to be a part of the community that you're in, because you are that community doctor in a lot of regards. I got involved with King County Medical Society through one of our attending physicians. And it just was a great opportunity to see how medicine comes from a different perspective. So really from a government perspective, and they go over a lot of the laws and legislation and things that you really aren't taught in residency. So that was one of the things that I did in regards to leadership outside of medicine. And then there was a lot of other opportunities for research that I think is very important. Faculty is split very, very thin, so you have to be a person that seeks it and goes after it. But the faculty that is there, if you go to them, any faculty member will help you get there. So I would highly regard people go into research, but do what you want to do. Family medicine is such a great avenue to research whatever you want, because it's such a broad topic. I was very interested in sports medicine, so I did research with that, but I also did research on scalded staph syndrome. Who would have thought? So I just think that when you go into residency, keep an open mind, and learning doesn't stop at medical school. You're going to be a continuous learner for life, so keep that momentum, keep that mentality as a resident, and you will go very far.
Thank you. So we want to transition again and, kind of open the floor up for you. We want students to have an opportunity to ask the panelists any question that you may have. Hopefully you heard something that you can relate to, or if there's something that you didn't hear that you want to know more about, please feel free. And I do see one hand. And could you stand up and give your name?
My name is Stephanie. I'm a 4th-year medical student at Rush, and my question is for the 4th-year medical students: how did you guys pick
I can start. So doing virtual interviews, I had a great discussion last night at the barbecue with a lot of medical students. It is very difficult, and just brace yourself. Virtual interviews are a different breed, and it's very hard to sense a residency. So the questions that you ask, I would target them to what you really are passionate about, or if they're open to it. For instance, our program does not do a lot of OB, and I'm very transparent when we do interviews about that. However, we do have opportunities to get that experience if you want to, because I personally know our faculty is open to that. So I think when you go through these programs, really try and navigate it in what your passions are. It's going to be hard to seek from the residents, I think, and you can kind of follow off me. Everybody thinks their program is the best, and it's going to kind of display it that way. So specific questions in regards to your passions, I think, would be the best way to navigate that.
I would completely agree. Looking back at what I did, so I went on Google and I typed in family medicine and capital, health equity, and urban, because those are the things that I wanted. And I just looked through the programs that came up on my first Google search. Were they in places that I wanted to be? And then I went through their website, looked at their mission and things. And it was really important for me to have a program that was community engaged, had space for community research or research in general, and then just had a really strong social justice framework. And I made sure I had questions, just like you said, targeted to those things. So what are you doing? Give me some examples. Looking at the residents and what their interests are, sometimes that's listed on the website. And if you see like, oh yeah, we kind of have the same thought process or same passions, because that'll really shape the trajectory of the residency program and the things that they focus on. So I think that's really, really important. So finding out, one, what your own passions are, whether that be like OB or not, or sports, seeing what they're already doing, and then like you commented on, is their capacity to do more. But also asking yourself, as a resident, do I have the time and space and energy to create new things as I'm learning to be a doctor? And you might. I kind of did a little bit. But you might not either. So I think keep that in the back of your mind too. And the last thing I would say is that no program is perfect. I think that's a thing that I had in the back of my mind, and that was just not, it wasn't helpful. There are going to be programs that are really great and something that you really, really love, and there's one thing you're like, dang, man, I wish they was great in that too, but they might not be. So that trade-off of how much of one thing do I really, really want and need, and what am I also willing to like sacrifice or not put as much into.
Mm-hmm. Yeah, I think this, I agree with what they both said wholeheartedly. And I think for me, what actually really guided a lot of my decision for my program was something that you had said, and it was that they didn't have like gender-affirming care, right? But when I said I was interested in it, they were so excited that I was interested in it. And then on top of it, I actually read their biographies, which everyone I know does, and sometimes people just like put up their biography. But what I noticed like in some of my top programs is the way that the attendings and just like faculty in general talked about each other, like saying like, I am so lucky to be working in this place with people so committed to community medicine, or like they just really reflected a lot of my values in the way that, and then I saw the way that they interacted with each other with like such care and just like such like human forward recognition. And I think that, you know, I am an IMG, and I studied in Cuba. I like didn't know much about the U.S. system, and I was like, I just hope to go to a place that is like very human forward and I think that if you have special interests, that is like so important, right? Because there's a degree of flexibility, there's a degree of understanding, and you know, we don't get these things right as we're like, if we are choosing to build things, and there's just like a lot of support around that. So yeah.
Just to fully echo everything that was already said in the up here, I do want to add as well. Yes, obviously you know that part of a good interview is tailoring your questions to the person that you're interviewing, so doing your research on the people that you're interviewing with. You're supposed to ideally get some information on who you'll be interviewing with the day before. the way I would, I definitely acknowledge that it is a little tougher to experience really what the program is all about through a computer screen. We, from a program side, we definitely try our best to show transparently what this program is, but it's also a challenge, and I can imagine it's very tough. There's a big thing about, do I actually want to live here? Do I want to be in this place or not? Because yes, this program can be incredible and it can have so much resources and so many things that will help me become a doctor. But if I'm miserable in the town or city or whatever that I'm living in for 3 years, that is not going to be very conducive of your quality of life. Yes, you practically live in the hospital and in clinic and in residency, but you also have to have a life and have to have things that echo your experience. Like, if I'm somebody that really does not care much for a very rainy, miserable day. So if there were programs in New England and in areas that were very rainy that I loved, but would I ever want to live in a place that just rained most of the time? Not really, because that would be very depressing for me. So I know virtually is hard. If you are able to attend a couple second looks, if you're able to, obviously most second looks should not affect programs because I understand finances and everything, but really in a program that you really, really like and they offer a second look and you're able to go see it and and see the vibe, because I'm sure people can kind of fake being kind to each other for an hour or two on Zoom, but you can't really fake the vibes when you're seeing them in person. If you're able to assess that vibe and how people engage with each other in person, I highly recommend it. I think you can tell a lot based on when you compare what something looks like on paper versus when you actually are in it and you see it in person.
Absolutely. Do we have other questions? I know there's some up there. Come on up. What's your name? Okay. Thank you, Eugene. What steps did you take to prepare for all this?
Oh, the hardest question we're going to get.
Oh, man.
Okay, I guess I'll just be quick about it's a great question, Eugene.
Mm-hmm.
I think there's a lot of nuances that can come into finding your path in medicine. There's, yes, this whole prestige of like, yes, I'm a doctor, blah, blah, blah. But it's also, don't go in it you're not in it for the money, because you will be working way, way, way hard, starting off with negative hundreds of thousands of dollars compared to people who can go into business, graduate in 4 years, and like make millions way faster than we would. So it's not about the money. It's really about a specific passion that you do, that you have this desire to really help a community out, probably to the detriment of your own soul sometimes, but in general, that's something that you really enjoy. And I think going into experiences that can facilitate that for you, maybe doing some volunteer work in hospital settings, in talking to physicians, going to different settings in clinic, outpatient, that can definitely help with that. And then really working hard in college. Really sorry to say it. It sucks because there's a big cutoff in order to get to medicine, you need a GPA, and that's working hard there too.
Yeah. My biggest advice is just as you go through life, just like let yourself be honest about what you want to be doing. I wanted to be a marine biologist for like so long, for many years, and then I realized I had to go to a state school due to finances, which I'm very grateful for, but I was at U of I in Urbana-Champaign, and we did not have a marine biology program. So I studied limnology, which is the study of freshwater biology, and I think I just let myself realize that I don't think I'm the person that can sit underneath a microscope, doing that work, and only interacting with others when we have like department meetings or Ecological Society of America meetings. So I just like leaned into the fact that I love talking to people and I love hearing their stories, and I realized that there's a lot of injustices that happen in our society, and I hoped to gain more resources to respond to that. And so I started leaning towards medicine. Luckily, a mentor pushed me that way. And then I looked for a school that I knew would give that to me. And so that's why I chose to study in Cuba. It's a choice not many make, but I think for me it was the right choice to be more in like a community medicine focused training environment. And then, yeah, we already talked about kind of what brought me back to Chicago. So just listen to like what makes sense for, well, everyone. We should all listen to what makes sense for us and our families and our communities, and let ourselves adapt and really work hard for what we know we should be doing.
Eugene, the fact that you're here shows that you already are starting like head first. It is so impressive that you are in high school and are here. So you should give yourself a pat on the back for that, because I know in high school I did not know I wanted to be a doctor. My mom is a nurse. I have no other physicians in the family, but I think everybody's story is very different. Some people, unfortunately, have traumatic events that lead them into medicine, but some people are just genuinely interested. Keep your resilience. I think resilience is one of the values of a doctor that is probably one that everybody has to have to get through residency, to get through your day-to-day life. So however you build your resilience, if it's through sports or if it's even through being here like you are today, keep going forward, keep moving forward, and don't let anything scare you away from your passion, because there's a lot of hiccups and hurdles that you'll have to get through medicine, and it just makes you a stronger doctor.
I think we may have definitely time for one, maybe two questions. Any other questions in the room? All the way in the back.
So
Anyone?
I can't, I think that I'm very happy you are interested in that, because I think that is like an incredible route for medicine and increases access exponentially. But I think, and I don't know, but I think something to consider is reaching out to people who maybe have done that work in the past that you know of in other programs, and understanding how they did that. Like I did a rotation with someone in LA who started something like that, and they ended up using their MPH to like build that programming and get funding. They actually got funding from local ERs because it helped reduce primary care visits in their ER by having these mobile clinics accessible to the community. So I think it probably is going to take a bit of research and connecting with people who have done it, or people who have found what I have found to be very creative ways to make that be. I think for incorporating that into a residency program while you're a resident, it may be difficult, but if like you have that energy for that, that would be incredible. And it might be something that maybe you continue to do, like, in your work after. Yeah. But that's awesome. Yeah.
I'd also recommend looking at maybe organizations within the city or state, because there might be organizations that have a mobile clinic that's not necessarily in conjunction with the residency program, but then you can then facilitate that relationship and make that maybe an elective time or a longitudinal thing that you continue to do. Like I think at University of Minnesota they do have a mobile clinic, but it's not necessarily with our program, but the opportunity is still there. So yeah, looking at the cities that you hope to be in and seeing if they have something like that, and bringing that up in the interview, like, I would love to connect this with that organization and do work with that, and yeah.
Yeah, I think, the theme that we have heard is you may have to do the footwork on that, we've heard that, we're already stretched a little bit thin. And so the fact that you have the knowledge of others who are doing it and have a mobile clinic, just learning, again, how they're doing it, what are the resources that they're using, and then bringing that to the residency, I'm sure most would be open to it because we do know that it increases access. So, absolutely. Any other questions? I got two. I'm going to try to answer.
Okay, that's a great question. And obviously every interviewer is different. Personally, my assumption is if you make it to the interview, you have the qualifications to be a resident physician. And hopefully a family medicine resident physician because you're interviewing for a family medicine residency position. But for me, it's do I want to work with you every day? Will I get a vibe of I want to actually have an engaging conversation about a patient and hopefully about life for the next 3 years? And it really doesn't have to be a hamming it up thing. It's really putting your most authentic foot forward and showing up, because this is a really long job for 3 years that you really have to want to be authentic 100%. If you present a certain personality in the interview, that'll be really exhausting very quickly if that's not who you are. So really coming in, showing up authentically, obviously having fairly well thought out reasons why you want to be a family doctor and all of that, but just coming in with who you are as a person as opposed to what you think so-and-so interviewer wants in a family doctor, because that's not helpful and that facade will fall very quickly. I think I personally look for a person I'd want to get to know for 3 years.
Absolutely. I'm going to try to get us one last question in before we.
I can start on this one. I don't know if this is the perfect answer, but I think once you get the interview, you are at the same baseline as everybody else. You have gotten there, so that chip that we have, I'm an international grad student as well, that's on your shoulder just has to go away because you are at the same level as everybody else once you get that interview. So you have to put your best foot forward and show them why you want to be there. The same way that we're interviewing you as a candidate, you are also interviewing us as well to see if we are a good match. And it's so important to be honest when you are interviewing because that's how organic fit is going to happen. I don't know if anybody else has a thing to add.
Yeah, and I think like even what you're doing right now is like putting yourself out there in a way. I think is really important too, to like come to meetings, come and meet people face to face. I think that and then connecting with people that, because it's like a different, you're coming into it differently, right? But you also have your own like network, you have your own resources, and I think like many international grads have their own particular networks and relationships, so take advantage of those. Like I think for me, prior grads of my school, it really helped me understand like how programs acted and what they did, and then yes, I very much agree, like once you get an interview, just be yourself, and that is super important.
Yes. Thank you to this amazing panel. Yes. please take time afterwards to find them roaming and ask questions. I'm sure they'll be willing to give you their information and how to contact them, because what we want to establish is that, they are here for you, and we are mentors, as we hope that as you go out in medicine, you will be mentors to others, and so that you pass your knowledge along. If you see me too, please feel free to ask questions. But we thank you, and we thank you for listening. And this will conclude, I think, we have a couple more words or housekeeping issues. And we will move to the next section.
So thank you again to our entire panel. I'm just going to run through a few items before we continue our day. So if you haven't already, please download the Family Medicine Midwest app from either the App Store or the Google Play Store, as it is key to your involvement at this conference. This is where you'll see and set your own schedule, and then also see a list of the residency programs that will be at the fair later this afternoon. Remember to tag FMM on all your social media posts with hashtag FMM Midwest 23, and then to follow us on Twitter and Instagram. And if you have any questions about the app, go ahead and visit the registration desk, where staff member will be able to assist you.
And just some more announcements as well of just the next couple of things going on. So international medical school attendees should attend the international student prep in room 162 starting at 1:30. Our pre-med students can head upstairs for our Family Medicine Now session that starts at 1:30 as well, and is in room 266. And Andy and Alex will actually be presenting at that. So you'll see them again there. And there are 3 more student sessions happening in room 164, 166, and 167. And again, all of this is on the app as well. Be sure to take some downtime to visit the supporters in the atrium and learn about the different organizations that are here with us today. We have poster sessions happening from 3:15 to 4:15, and there is more posters that are submitted by medical students that'll be on showcase in room 105. And lastly, the final event of the day is the Residency Fair, and that opens at 3:45 in the ballroom, and it's open till 6:15. So there's plenty of time to peruse and see which programs you want to visit. And we have over 50 programs, so be sure to check them all out. And there's tips on the FMM website to help you further. And if you have any questions at all throughout the rest of your day or get lost, you can ask anyone that's wearing an Ask Me button. And the day concludes with the Residency Fair. So we hope you have a wonderful afternoon, and we hope to see you tomorrow as well.
We're going up to 266.
Thank you all.
Good job. That was